Good evening. Welcome to another self-care talk. We're going to be dealing today with medical issues with the pandemic, the global pandemic of COVID-19. Our senior pastor, Dr. A. Jermaine Lewis, has asked the Health and Wellness Ministry to have representatives who will give talks on various aspects. It's normal in these times to have anxiety or frustration or depression, and last week's talk dealt with mental health issues and related to self-care during these trying times. And today we're going to be talking about medical or physical issues that deal with self-care and the coronavirus. You have heard it called different names, including COVID-19, or you may have heard it called novel coronavirus, or you may have heard it called SARS-CoV-2. The coronaviruses is a large family of viruses that can affect different species. That includes persons, human beings, that includes cattle, camels, and even bats. But this is a unique and new virus that was discovered in December 2019 in Wuhan, China. And a lot is not known about this virus because it is unique and has never occurred before. Therefore, there is no vaccine and little experience with it. There is even the question of whether or not this virus has seasonability like the flu virus, which normally is in the fall and winter months. But that still has yet to be determined. But again, this virus is unique, different from the flu in many ways, and different from any other viruses that we have ever experienced. As far as transmission goes, it's spread by respiratory droplets from an infected person. And it is spread normally person to person when that infected person coughs, sneezes, or talks. As far as how contagious COVID-19 is, it is more contagious than the flu, but it is less contagious than, say, the measles, which is considered to be highly contagious. So in order to minimize transmission, it's really important, if a person is infected, for them to stay home if they're sick. They should wear a mask that covers their mouth and their nose, and those people who are living in their household with them should also wear masks to prevent them from getting the virus. As far as symptoms go, there's a range of symptoms. Some people are infected with the virus and have no symptoms at all. Then there are others who may have mild symptoms or severe symptoms, or the spectrum can go as far as to have acute respiratory distress syndrome, in which one cannot breathe on their own and require the use of a ventilator for breathing. Some patients, but not all patients, will have loss of sense of touch, loss of smell, loss of taste. Some will have fever. Some may have a cough, which may be non-productive or may be productive, and some may even have shortness of breath. As far as the incubation period, the time between when you get exposed to the virus and begin to have symptoms can range anywhere from 2 days to 14 days, anywhere from 2 days to 2 weeks before you have symptoms. And again, those symptoms vary. Most of the symptoms are mild and can be treated by hydration, staying at home, and maybe using over-the-counter medications for symptomatology. One of the main things to do if you are infected is to be sure that you hydrate yourself well. As far as risk factors, there are a number of risk factors for undergoing serious complications. There are no specific risk factors for contracting the disease, but there are a number of risk factors for having serious complications if infected. And the first group of people who are at prone, if they are infected, to have serious complications are those who are senior citizens. And in the literature, you will see sometimes where it says if you're over 65 years of old, you're at high risk. Or some will say if you're over 60 years old, you're at high risk for complications. If you reside in a nursing home or a long-term care facility, you also are at high risk for having possible severe complications. Any person, regardless of age, who has serious or long-term lung disease, pulmonary disease, can have serious complications. So that's going to include patients who have COPD, including chronic bronchitis, including emphysema, including patients whose asthma is considered to be either moderate or severe. Any patients who have cystic fibrosis also are at high risk for having possible serious complications. Any patients who have chronic heart disease are at risk also for serious complications, whether that be coronary artery disease, whether it is congestive heart failure, whether it's cardiomyopathy, whether it's hypertension, whether it's congenital heart disease. They also are at risk for possible serious complications. If you are immunocompromised for any reason at all, you are also at risk for possible serious complications. And that would include patients who are smokers, smoking of any type at all. That would include patients who have undergoing treatment presently for cancer, whether that be chemotherapy or radiation therapy or a combination. People who have undergone either a bone marrow transplant or an organ transplant and are on anti-rejection medicine, therefore are also immunocompromised. Patients who are HIV positive or have AIDS are also at high risk. If a patient is taking prolonged oral corticosteroids for medical conditions, such as severe asthma, such as lupus, those patients also are at risk. If any patients are taking any oral or injectable immunologicals for conditions such as rheumatoid arthritis, psoriatic arthritis, for eczema, for psoriasis, Crohn's disease, for ulcerative colitis, rheumatoid arthritis, chronic hepatitis C patients who are taking medications for hepatitis C, or patients who are taking medications for a treatment of chronic hepatitis B are also at risk. If a patient is severely obese with a BMI over 40, they also are at risk for serious complications. Patients who are diabetic, whether that diabetes is type 1 or type 2, they are also at risk for possible serious complications. Any patients who have been diagnosed with end-stage renal disease and are receiving dialysis, whether the dialysis is hemodialysis or peritoneal dialysis, they are also at risk for possible serious complications. Any patients who have chronic liver disease, again, like hepatitis B or C, even if they are not on treatment, they are also at risk. That is going to include any patients who are waiting for a possible liver transplant or a possible organ transplant, again, are at high risk. And those are the patients who especially need to wear a mask that covers the mouth and the nose. Also, avoid public exposure as much as possible, to practice regular, frequent hand washing using soap and water. And be sure when you're washing your hands that you lather up both on the palms, the backs of the hands, in the webs of the fingers, and even on the fingernails in order to prevent spread. Those patients who are at high risk, and if they have any kind of symptomatology suggesting a fever more than 100 degrees, or if they're having chest pain or chest tightness or shortness of breath or dyspnea on exertion or dyspnea without exertion, they need to probably call 911 and probably need to have those symptoms addressed. As far as prevention goes, the main thing is to avoid exposure. Therefore, the CDC recommends that you practice social distancing of at least 6 feet apart, and also wear a mask to cover your mouth and your nose if you're going to be in public, besides the frequent hand washing. And again, The masks are, the purpose of that is not only to prevent you from catching it from someone else, but if you already have it and you are unknowing and an asymptomatic person who is can spread it to someone else, that can protect them also. Again, it's going to be, if you have no access to the soap and water, you can use a hand sanitizer that is at least 60% alcohol. Keep in mind you want to avoid touching your mouth, your nose, or your eyes. As far as testing goes, in the United States, since we're so far behind the curve, we need to practice the social distancing. We need, in a dire situation, we really do need to have more widespread testing for diagnosis, for diagnostic tests. There are different kinds of tests that you will hear about when it talks about testing. But the one that's needed the most right now is diagnostic tests to know who does and who does not have the disease. There's another test that you probably have heard about that talks about antibody testing. Now, antibodies are proteins that are generated by the immune system when you are exposed to a virus or bacterial infection. And you can measure the level of the antibodies, but that will tell you if you have been previously exposed and to what extent you may be immune to a recurrence since you have the antibodies. But again, those patients who do not have any of the antibodies, they are prone to receive or to be infected by the virus. There's another type of testing that's being done more frequently in Europe called viral load testing, where they actually, with a blood test, are able to measure the amount of the particular virus that you have in your body. We are not at that stage yet where it's going to be needed as much as diagnostic testing in this country, but that is being done in Europe. As far as treatment goes, treatment is symptomatic. There is no approved, proven, safe, and effective treatment yet. So, depending on your symptoms, again, hydrate yourself well. But if you develop fever more than 101 degrees, or shortness of breath, or chest discomfort, or if that person who is infected becomes confused or has difficulty to be aroused, then 911 should be called. You have heard and will be hearing about different medications for the treatment, including hydroxychloroquine alone with azithromycin, an antiviral called remdesivir. Hydroxychloroquine has been around for some time and has been used initially to treat malaria. Also can be used for collagen vascular diseases such as lupus or rheumatoid arthritis. It does have possible side effects, which can include an irregular heartbeat, where the heart skips beating as a side effect from the medication. The same can be true of azithromycin. Now, azithromycin is actually an antibiotic, but it has been found to have some antiviral activity and also anti-inflammatory activity. Keep in mind, many of the patients who develop the pneumonia, which causes acute respiratory distress syndrome, that is a viral pneumonia, but sometimes patients have a superimposed secondary infection that is bacterial in addition to the viral pneumonia. And so some of the studies that have been done are examining whether azithromycin, in addition to hydroxychloroquine, will be effective in those patients who have severe disease, many of whom have had to be intubated and had placed on a ventilator. Remdesivir is an antiviral that was used in approximately 2014 for the Ebola outbreak, which was a different virus, and it was found to be effective. So studies are being conducted all over the world to see if maybe that antiviral will be effective. And then there are other antivirals that have been used, including some of those which have been used in the treatment of HIV/AIDS, are also being investigated. So all these studies are ongoing all around the world, but it may be months before we have any positive results by random conducted trials about whether a medication or a treatment is safe and effective, so that may be months away. You also have heard discussions about vaccines. Again, since the virus is brand new, there is no current vaccine to treat COVID-19. There are all kinds of studies going on, and there are different facilities, medical facilities all over the world that are looking for a vaccine. Keep in mind that the COVID-19 virus is unique and special, and it's been making mutations or having mutations approximately twice a month in these last 4 months. So there are at least 8 different strains of the COVID-19. And so the vaccine that's going to be used, which has to be safe and effective, is going to have to be effective against all those strains. So those are ongoing studies also going on. You may have heard Dr. Fauci with NIH and CDC say that hopefully they may have a vaccine in 12 to 18 months, and that is best case scenario. So best case scenario, we may have a vaccine maybe by the fall of 2021. Keep in mind that the quickest that any vaccine was discovered was the mumps vaccine, and that took 4 years. So again, in the meantime, until we have really widespread, by the millions, diagnostic testing, the idea is going to be to, again, prevent exposure, social distancing, wear a mask in public. You also may have heard about racial disparities, and that a large number of patients who are severely affected and dying are of the African American race. Keep in mind that because of the racial disparities, because of socioeconomic reasons, many people on the lower rungs of the socioeconomic ladder do not have adequate access to care. When I became a medical student in 1971, there was a debate at that time about, does every United States citizen have the right to access to medical care? So this has been going on for decades. There are still members in Congress and in the Senate who still debate whether or not access to care is a right. And that was one of the purposes of the Affordable Care Act during the Obama administration, was to try to correct some of those disparities. So this has been going on for decades, and we have still millions of people in this country who are uninsured. Now, we have received some questions related to the COVID-19, and especially related to patients who are diabetic. I'm going to read some of these questions and answer them to the best that we can. First question says, am I more likely to contract coronavirus because I'm diabetic? The answer to that question is no. None of the risk factors deal with whether or not you're going to contract the virus. Those risk factors that I mentioned earlier address the question of severe complications if the coronavirus is contracted. Now the question says, if contracted, does the severity of the virus matter if I'm type 1 or type 2? And the answer to that question is no also. It doesn't matter whether you're a type 1 diabetic and you require insulin, or if you're a type 2 diabetic who can be controlled possibly with diet alone, or diet plus medications, or diet plus medications plus injections. It does not matter what type of diabetes you have. The severity is not determined by the type of diabetes, or whether you're a gestational diabetic, or if you may be already diagnosed as being pre-diabetic. Now the question says, am I more likely to have complications with coronavirus being diabetic? And that answer is definitely yes. And for a diabetic, you want to do the right thing as usual. So you want to probably, if you are infected, more closely monitor your finger stick glucoses. You want to, again, treatment for diabetes includes managing your diet correctly, avoiding sweets, taking your medications, and having some activity or physical exercise. Another question says, how much more at risk of severe complications am I because I'm diabetic? We don't know the answer to that question at this time. It's basically too little information for us to be able to give an answer to that. And again, the thing is going to be, the best thing you can do is just try to control your diabetes as well as possible. Next question says, what percentage of victims have been diabetic? There have been some small early studies of patients who were hospitalized but not requiring ICU hospitalization, and in those small studies, approximately 24% of the patients who were hospitalized not requiring ICU stays were diabetic. There's been some other smaller studies that have about severe COVID in which they were ICU hospitalized, and approximately 25% of those patients who were in the ICU were diabetic. Another question says, what percentage of diabetics recover from coronavirus? We do not have an answer to that question. There's not enough information yet to give a valid answer. That is still unknown. Another question says, how does coronavirus affect diabetics? The coronavirus infection, just like any other infection, whether it's viral or bacterial, can cause your sugars to run higher than normal. So that's going to, again, require you to be vigilant and fastidious in continuing in following your proper dietary restrictions, taking your medications, and getting some exercise. But you probably will need to check your sugars more often than you normally do. Another question says, if they contracted the virus and recovered, is my diabetes going to remain impacted? That is, organ function, etc. So the question is, if a patient who is diabetic has contracted the virus and has recovered from the virus, is the diabetes going to remain impactful? Well, just like any other infection, once it's resolved, you're still going to have to do what you normally would do after you've recovered. Keep in mind that diabetics are prone to have certain complications, including retinopathy of the eyes, neuropathy of the nerves where they lose sensation of touch, and also nephropathy where the kidneys don't work as well. So those will still be things that you have to consider and still have to manage your diabetes well. For a person who is not diabetic but is hypertensive, the principles still stay the same. You have to watch your salt and your salt intake, take your medications, get some exercise, and just follow the instructions and recommendations by your healthcare provider. So, just for some summary recommendations, if you are sick and your symptoms are not severe, you need to stay at home and wear a mask. If you're well, minimize your public exposure as much as possible and wear a mask when in public. If you are living in a household with somebody who has been diagnosed as COVID-19, then you need to wear a mask. We need to continue practicing social distancing, staying 6 feet apart. We need to continue the practices of washing our hands frequently with soap and water for 20 seconds. And remember also to wash not just the palms of your hands, but also the back of your hands, the webs of your fingers, and also your fingernails. Be sure to cover your mouth when you cough or sneeze using the inside of your elbow. You probably need to clean the surfaces that are frequently handled in your household, probably daily. It would be recommended you avoid unnecessary visitors to your home. If you have no access to water and soap, then use again a hand sanitizer that is at least 60% alcohol. Avoid touching your mouth, your nose, and your eyes. And again, practice social distancing, wear a mask in public. These may be measures that are inconvenient, but keep in mind that they do save lives. So again, make good decisions regarding your health care and the health care of others. Thank you.